We worked so hard for like 2 decades to bring this story bench to bedside. And it wasn't a time where we could afford to sit back and take a few months or a year off, right? Basically. And so everybody, and I have to say, I do have really great staff. There were some wonderful people there too. And we had some people that would walk in the snow for 45 minutes because they were scared to take an Uber or scared to take a cab. I'm lucky that, I had a team of people that worked together, and when they couldn't do something, then I stepped in, because as the leader, that's what you do. This is my lab. And if I'm afraid to do it, I can't expect them to. So, but I don't view anything in life as some horrible obstacles. I don't believe in obstacles. I think everything's a challenge and there's always a solution. You just have to figure out what's the best solution for you. I went to grad school. I was part of the Genome Project and sequenced human chromosome 15 and found this gene, NR2E3, as part of what we were studying. And it actually was a candidate gene for Bardet-Biedl syndrome. So I helped identify probably a dozen different human disease genes during my graduate work, and then kind of followed this gene and made a career out of one gene. So that is possible, and developed a model in the therapeutics. And we have the US patent actually just this year was officially issued. We have FDA approval and European approval at the EMS, and it's now in 7 clinical trials. So it's exciting. I mean, to me, the greatest achievement in a few months or a year, if somebody says they can see better because of something I did. That was my goal as a grad student. And even, when I started my lab, it always had a translational element. It always was like, how can I turn what I'm doing into something that's going to benefit society? And so my focus, even though I do mouse models and I collaborate with our friend Meg, like for human genetics studies, right? The brain's always thought, how is this going to help people? Whatever I'm doing, how is it clinically relevant? How is it relevant to the patient? The models that we choose, how are they relevant? We're just wrapping up another round of preclinical work, and the data is really remarkable. I get excited looking at it every time. It's modifier gene therapy. So you have a mutation in one gene, but we can treat with something else, and it's resetting homeostasis. That's what's happening. It's a master regulator of multiple networks and hundreds of genes, and it's able to reset this homeostatic state so you don't have the non-cell autonomous death. And if you do it early enough, you can preserve the cells. And so that's what we've been able to do, and we can show it in multiple models. And so I think it'll be great for 40% of patients with retinitis pigmentosa have nothing. They can't even have a molecular diagnosis. And many of those that have one, the genes are too big for the gene therapies right now. It's just not amenable to that. And so it really offers something for a good population of people that have this condition that have nothing. And our next studies that we're doing in collaboration with Meg are with AMD. And I think we have something great there too. So stay tuned. Project was NIH funded for 13 years straight. When I did not write the renewal, I chose not to because I didn't need to. Now we needed more money to do preclinical work than one R01 would suffice. And rather than hobble together a few grants, I got a company to sponsor it, and it's the equivalent of several R01s. Before COVID, I would go at least 3 times a year to Congress with my AMDF foundation that funds my work. And we would advocate, and I point out that number for R01s, what is it, 250,000 a year? That was from 1999. We're in 2022. Come on. And actually, I'll also say, when I sit at study sections and people want to trim a grant, they don't need that money. I'm always the one raising my hand. No, don't do that, because that's barely enough to hire one person, and you want to accomplish so much money. So I'm always banging on the door of NIH and saying, you really need to come to the 21st century here. We need more money. You want to have high quality research, because NIH has changed its directive. It's not just pure discovery science. Grants when we were graduate students were funded at 40% now. And then when we started our labs, it was maybe 10%, right? And now it's maybe slightly better, but not a whole lot better. And the money is still not enough to take something to translation. you need to have industry support. We in the US, and I still think we have some of the best research in the world happening, but I see other countries, governments devoting a lot more dollars or their currency into research, which translate into a lot more US dollars. And so eventually, we're not going to be top on the research arena. I think we still are. I think we have high quality research happening here, but people, and actually it trickles down to, I'm an advisor for the graduate students at Harvard for one of the multidiscipline programs. A lot of them want to go into industry. So to keep young people in academia, it's a tough bite, right? And a lot of that has to do with constantly having the struggle to find funding. So I hope NIH improves and changes. And meanwhile, we're doing the best we can in terms of finding resources to move research forward in a translational manner. And NIH is great for discovery science and helping young scientists get started too. I think they have a lot of great initiatives for that, but there's a lot of room for improvement in terms of how much funding is given. As we all know, nobody can work in isolation, and it's so essential to the success of our careers to surround ourselves not only by amazing staff, but also by a community of colleagues, junior, senior, our level, at all levels, who support us and we support them. And I've been really lucky that Meg and I started very early in our career collaborating. I remember at the first Arvo, we saw each other. She gave a talk on RORA, and it was one of the first talks ever that highlighted this nuclear receptor that was important in macular degeneration. And I came up to her after the talk and I said, I think my gene regulates your gene. And from then, we ended up having a beautiful collaboration, a great friendship. She's one of my best friends. And we published a paper, I think, within the first year. We wrote a grant within the first year. And so it was a really successful both collaboration and grew into a beautiful friendship. And in addition to that, I think we were very blessed, both of us, that we had another senior colleague to us, Dr. Cheryl Kraft, who was just instrumental. I mean, an unwavering support, both on my personal life and my personal cancer journey even, and professionally, just an advocate, a sponsor, a mentor. And she's been just such an incredible role model for me, you too, I'm sure, Meg, just to say how to be a good mentor, how to be a good sponsor. I've learned so much from her in particular, and it's not always easy to find. Meg and I and Malia, we go out of our way. We've, been part of Weaver for many years, Meg and I, and we were part of the women's leadership groups and then the mentoring groups at Arvo. And this past Arvo, I think the two of us, as well as with Malia, we had probably 16 people at a time come to our mentoring table, and we spent hours just being a support system for these young ladies that are in earlier stages of their careers than us. And sometimes we've even helped mentor and talk to people that were later in our career stages than us. And it was just a great community of people that are supportive and with no hidden agendas and just there for each other. It's a mindset of positivity. I wake up and I think today's a new day for me to do something amazing and great. And what do I want to accomplish today? And some people have told me that, oh my gosh, I speak in these grandiose and larger than life terms. And to that I say, the higher you dream, the more you achieve. And my philosophy and what I want to achieve is grandiose. And so that's how I speak that way.